Hello everybody, I am Dr. Amit Agrawal from Mahatma Gandhi Vidya Mandir's Karmavri Bhavsaheb Hiri Dental College and Hospital, Nasik, India. Today we'll see a presentation on orange peel as a preclinical model for surgical incisions and suturing techniques in dentistry. I'm sure everybody remembers Munna Bhai MBBS. So when he first time take the incision on a dead body, he gets fainted. I'm sure nobody would like to end up like Munna Bhai at his first incision. Had you only practiced it first on the preclinical model, maybe the scenario would have been much more different. Preclinical models are not very new to the field. Synthetic models such as surgical simulator are currently the high-tech technology in preclinical models. Very similar to anatomy, good tissue feeling, but they are not only too difficult to procure but also very expensive. Other synthetic models such as rubber sheets, latex or rubber models, Macintosh sheets, they are cheap, but they don't give the feel of working on tissues and they are not environment friendly. Other models such as animal models are very commonly used in courses and hands-on sessions. They include pig jaws, pig skin, pig foot, goat jaws. They are also cheaper, but there is a danger of contamination from either needle stick or blade, accidental ingestion of particulate matters or by brucellosis, leptospirosis. There are also some religious issues. Some participants, some students might not want to touch raw meats. Other than this formalin irritation, because of for which they are stored in formalin, that irritation cause difficulty to the eyes. Not to mention the procuring of these parts, storing them, and then ultimately disposable of these animal parts after the training is done is a big problem. Fruit models is another nice area where literature has been shown, including raw banana, ripe banana, and dragon fruits. They are also cheap, they are eco-friendly, but then they don't give the feel of tissues, at least at these three models. Either they are too soft like your ripe banana, or they are too stiff like a raw banana. In literature has all been recommended on using them directly on the fruit, that is practicing suturing directly on the fruit. There is no literature support which shows that you can peel it and adapt it on the model. So here we present our own best option. What we feel is orange fruit peel. It is a very apt as a preclinical training models, and why that we'll see in future slides. It has two distinct layers. One is the outer thin stippled layer, that is zest. It represents the gingival alveolar mucosa at the time of incision suturing. The inner thick semi-stiff white mesh, that is called the pith, that represents the connective tissue which gives that feel of the needle passing it through the tissues. The incision needle bite of the suture needle gives a very close feel of the incision and suturing on gingiva and alveolar mucosa. The orange peel can be used directly on the fruit itself, as been shown for other fruit models also, or it can be peeled off and stuck on a dental cast or models, which can be either edentulous models or dentulous model, depends on the procedure what you need to practice or demonstrate. So this is the most basic model for use of incision practice on the edentulous ridge. So there are some images of the same. The way in which I found the orange peel to stick on the model works most commonly with the Fevicol than with the Feviquick. So that is one thing you can incorporate when you will start making your own models. This is a short video on how the incision can be taken. So 15 number blade is used, crestal, releasing. This video and all other videos in this presentation are slightly fast forwarded so that we can cover more different types of video in this particular period of time. Another indication is periosteal release incision and adaptation of membrane under the flap. Now there is no model which have been seen in the literature which can give you practice of practicing releasing incision model, periosteal release incision in a model. So it's a very nice indication. Periosteal release incision is given to the flaps at the base beyond the mucosal junction to release them of the periosteum or the restrictions. So once you are doing grafting, contour augmentation or GBR, you need to close the flap the primary closure without tension. So this type of incision helps. This is a small video on how to take it. So after reflecting, use a sharp 15 number blade at 45-degree angle, just deep enough to cut the periosteum, and the flap is released. You can nicely pull it off, carry it way beyond the crestal area. This is a GTR membrane we are adapting under the flap. One more nice indication is harvesting of fringe allograft. With the advent of now implant practices and management of tissues around implant dentistry, a lot of dentists, a lot of implantologists wants to or feel the need of taking a free grafts or free connective tissue grafts. And this model is a perfect way to practice it before going to the patients. Let's see how it is done. Now this is a template which is kept on the palette so that extra amount of tissue is not required. After the outline is done, we can use a blade. Now in this video you can see there is a different type of instrument. Instead of 15 number blade, this is a ivory number 8 actress retainer on which we have adapted a razor blade. This is another model which we have developed at our institute by me, and we have published it also. The procuring of fringe graft becomes very fast, and the graft itself is very smooth. It takes hardly 1 or 2 minutes to take out the FGG. Another indication nice as I said is harvesting connective tissue graft with single incision. Again, this is a very skilled procedure which requires some practice. So how it can be done? After the incision is given on the palate, this is, you can see the 3 layers as we see in the intraorally. The outermost tissue layer, the central connective tissue, and at the depth there is the bone. So you hold that connective tissue, the center part, with a tissue forceps, and then you can release it from all the sides. Releasing it from the mesial side, from the base, that is toward the depth of the palate, and toward the distal. So be sure you have released it from all the sides and the graft is out. Okay. This is one of the important concepts called as membrane stabilizing suture. So many people wants to stabilize the membrane, but they don't want to use tack pins. So this is one of the nice suturing which we can practice on orange peel model. After your GTR membrane is tucked inside on the defect under the flap, this is one way of doing it, starting from the depth of the tissues, that is from the periosteum, bite first, and then take it out on the lingual flap. Go back from the palatal flap, take another bite in the periosteum, and give a knot at the depth. But this might be slightly difficult to do intraorally. So a better way is to start it from the top, that is started from the palatal flap. Then take a single bite in the periosteum, go back to the palatal flap and then suture it. It's more easy, no need to take bite 2 times at the depth, no need to put a knot in the periosteum, and it is more easy to do. One more time, taking a bite from the palatal flap, going to the periosteum, again back to the palatal flap, and your knot. And the membrane is nicely stabilized. Over that, then you can cover your mucosal flap. Switching for mucosa. Now that membrane stabilizing suture was done. Now here we are doing interrupted loop suture. Most basic suture is required for almost most of the dental procedures, surgical extractions, alveoloplasties and all that. This is again a loop suture. The same model we can practice interrupted figure of eight suture, horizontal mattress, vertical mattress. Absolutely no problem. So the applications for this model are virtually unlimited as far as the soft tissue management for the intraoral use is concerned, and there are no previous organic or eco-friendly models which have shown such varied indications. We are on the way of already doing a multi-center study in 4 different countries to validate the use and preference of this model among students as a learning aid. And the results will be coming soon, and we're planning to publish in few months. Most of these videos are uploaded on the YouTube. Some are yet to upload. If somebody wants to see it in full detail, they can just search it through the YouTube channel. So thank you so much for your patient listening. I hope you incorporate this orange pit model at your own setup in your own institutes and get the benefits, train your students in a better incision and suturing preclinically. Thank you so much.